If a doctor recommends surgery, stop. There are 5 very common operations that are prescribed far too often, and in most cases, they can be avoided. I'll walk you through each one and tell you what actually works instead of going with a knife. Every surgery leaves scar tissue. It's irreversible. You can't undo it. That's exactly why, before agreeing to any surgical procedure, you need to exhaust every conservative option first. Today, I'll show you 5 operations where this is especially important, and I'll tell you exactly what to try before going to the operating table. The first surgery, a herniated disc. This is probably the most common spinal operation, and the most frequently unnecessary one. When is it actually needed? Only in one situation: when a nerve root is compressed so severely that the person develops significant weakness in their legs or loses control of their bladder or bowel function. That's serious, that's rare, and that is a genuine indication for surgery. But in most cases, the picture looks very different. Someone comes in with chronic lower back pain. They get an MRI, a herniated disc shows up, and immediately the word surgery comes up. Stop right there. Here's what's important to understand. If you took 100 perfectly healthy people with no complaints whatsoever and put them through an MRI, half of them would show disc protrusions or herniations. People who live normal lives and feel completely fine, which means a herniation on a scan is not a diagnosis. It's not a verdict. The real problem is something else entirely. The lumbar spine is mechanically overloaded. The muscles are tight. The pelvic bones are misaligned. Sometimes the root cause is in the hip joint or an old head injury that threw the entire body out of balance. And until we address those underlying causes, treating only the herniation is pointless. And here's something most people never hear. A herniation is not a breakdown. It's an adaptation. The body creates its own support where the vertebrae are unevenly loaded. If we surgically remove that support, the body will create a new one, above or below the site of the operation. This happens all the time. So before agreeing to surgery for a herniated disc, find a specialist who works on the cause, not the symptom. Back pain that has lasted for years can resolve after the right treatment. I've seen it hundreds of times. The second surgery on our list touches on a topic most people don't like to talk about openly, but it affects an enormous number of people. And surgery for it is recommended almost automatically, even though in most cases it can be avoided. The second surgery, hemorrhoids. A delicate topic, but an extremely common one. And surgery for it is recommended frequently, even though almost nobody explains the mechanical cause of this condition. Here's what's actually happening. Hemorrhoidal veins don't enlarge on their own. Blood pools in them because something is blocking its normal outflow. And that something, in most cases, is the prolapse of the internal organs. The organs drop into the lower abdomen, press on the vessels, blood stops circulating properly, and the veins swell. There's another factor that's almost never considered. The sacrum, the bone at the base of the spine, is supposed to make small rhythmic movements. It acts as a natural pump that helps drain the hemorrhoidal veins. When the sacrum is blocked, the pump stops working, and it gets blocked most often from an old tailbone injury. You fell years ago, hit it hard, and forgot about it, but your body didn't. And here's something even more remarkable. The base of the skull and the sacrum are connected to each other through the dura mater, the tough membrane surrounding the spinal cord. What's blocked at the top gets blocked at the bottom. So an old head injury can directly affect the condition of the veins in the rectum. It sounds incredible, but this is anatomy. When you address these causes, lift the organs, release the sacrum and the base of the skull, hemorrhoids stop progressing. In a number of cases, the symptoms resolve completely without surgery. Does hemorrhoid surgery sometimes become necessary? Yes. But before agreeing to it, understand the mechanical cause first. Otherwise, even after surgery, the problem will come back. The third surgery on our list concerns women exclusively, and very often it's recommended at exactly the moment when the problem can still be solved independently, literally within a few weeks of the right exercises. Listen carefully. This could preserve your health and save you from a serious intervention. The third surgery, diastasis repair. Diastasis recti is the separation of the abdominal muscles along the midline. It most commonly develops after pregnancy and childbirth. When the separation is large, 6, 7, 8 centimeters, doctors often say, this is an indication for surgery. It needs to be sutured. And the woman agrees, because she doesn't know there's another way. Here's what that other way looks like. The right exercises for the deep core muscles can significantly reduce diastasis, sometimes within a matter of weeks, not years, weeks. I've seen this repeatedly in my own practice. Women who were told they needed surgery started doing the exercises, and the separation closed to normal values without any intervention whatsoever. And here's something fundamentally important to understand. Surgery stitches the muscles together, but it doesn't restore their function. The muscles don't become stronger after surgery, they're simply pulled together mechanically. But this woman has to live in this body, move in it, carry children, go about her daily life. She needs muscles that actually work, not scar tissue. So if someone tells you your diastasis needs surgery, try the exercises first, the right exercises, with a knowledgeable specialist. The result may surprise you. The fourth surgery, and here I want you to pay particularly close attention, because this doesn't only concern people who already have the problem. It concerns anyone who is just beginning to notice the first signs. And it's at exactly this stage that most people miss the window when everything can still be stopped without surgery. I'm talking about varicose veins. The fourth surgery, varicose veins. And here there's something important that conventional medicine almost never explains to the patient: how varicose veins develop. The internal organs gradually drop into the lower abdomen. They begin pressing on the blood vessels. Blood stops flowing normally out of the legs. The veins expand. First, small spider veins appear, then small knots, then large bulging nodes, year after year. Gradually. The situation is made worse by pregnancy, childbirth, heavy lifting, and chronic constipation. And if the vein walls are also weakened by a deficiency of vitamin D or other nutrients, the process moves faster. Now about the surgery. Laser procedures, sclerotherapy, mechanical vein removal, all of these produce a good cosmetic result, fast, visible. But the question isn't whether they work. The question is, for how long? If the organs are still pressing on the vessels from above, the veins will start expanding again, in 2 years, in 3, and the surgery will have to be repeated. I've seen this many times in my own practice. Women would say, yes, they removed the veins, but 3 years later I had to go back. The surgeon did nothing wrong. He did his job well. The underlying cause simply never went away. So the logic is this. First, lift the internal organs. Remove the pressure on the vessels. This will stop the progression of varicose veins. In the early stages, this alone may be enough to avoid surgery altogether. If the varicose veins are already significant and you want them removed, first lift the organs, restore the nutritional support to the tissues, strengthen the vein walls, and only then surgery. That way, once and without recurrence. And finally, the fifth surgery. It's directly connected to everything we've been talking about today: organ prolapse. This is a topic that many women silently endure for years, and yet this is where the cost of waiting is highest of all. Because the earlier you take action, the greater the chance of avoiding surgery entirely. The fifth surgery, pelvic organ prolapse. And this is perhaps the situation where waiting costs the most. Here's what happens. On one side, the internal organs are pressing down from above. On the other, the pelvic floor is weakened and can no longer hold things in place. Gradually, the vaginal wall begins to descend. Then the bladder, the rectum, the uterus follow. This doesn't happen overnight. It's years and decades of slow, quiet changes. And here's the problem. Most women find out about this only when the situation has already gone quite far. The gynecologist says during a routine exam, you're showing early signs of prolapse. And what usually happens next? The woman nods, goes home, and does nothing. Because it doesn't hurt yet. Because it isn't causing problems yet. But that moment is the most important one of all. Because at the early stage, lifting the internal organs and strengthening the pelvic floor muscles can stop the process entirely and restore everything to its proper position, without surgery. I had a telling case in my practice. A woman with first-degree prolapse started doing the work and improved significantly. Then she stopped, decided everything was fine. 5 years later, she came back, and the situation had deteriorated to the point where surgery was unavoidable. This isn't a story about exercises not working. This is a story about the fact that the work needs to be consistent, and it needs to start the moment your doctor first says the word prolapse. So if your gynecologist has used the word prolapse, don't wait. Start lifting the organs and strengthening the pelvic floor right now. This is your most powerful tool, and it works if you don't wait too long. We've gone through all 5 surgeries, and in every single case, the same logic runs through. Let me state it clearly, because this is the central message of everything we've discussed today. Here's what connects all 5 cases we've covered today. In every single one of them, there is a mechanical cause: misaligned bones, prolapsed organs, muscle tension, blocked joints. And until that cause is addressed, neither surgery nor medication will produce a lasting result. Remove the symptom, it comes back, because the underlying condition never went away. I'm not saying surgery is never necessary. There are situations where surgical intervention is genuinely unavoidable. When a nerve is so severely compressed that the person loses sensation in their legs. When varicose veins are so advanced that conservative treatment can no longer help, when prolapse has progressed too far. In those cases, yes, surgery is needed. But even then, address the mechanical cause first. That way the surgery happens once and without recurrence. So to recap, herniated disc, find the source of the overload first. Don't rush to the operating table. Hemorrhoids, lift the organs, release the sacrum. Diastasis, the right exercises can resolve it within weeks. Varicose veins, first remove the pressure the organs are placing on the vessels. Pelvic organ prolapse, act at the first warning from your doctor. Don't wait. Leave a comment below. Which of these 5 topics affects you or someone close to you? I read every single comment and I respond. If this video was helpful, subscribe to the channel. Every week I cover health topics that help you make informed decisions without unnecessary surgeries and without unnecessary medications. And if your lower back has been giving you trouble, watch this video next. I go into detail on why back pain almost never requires surgery and what you actually need to do to make it go away. Link is right here.